So a second way of being is cultural safety. So this is something that when you take a look at the experience of Indigenous folks in this province, but certainly anywhere in the colonized world, and I'll actually use this opportunity to read an excerpt from Korchak, which I just thought was, if I can find my glasses, that is. Let me just set the stage for you here. So he said, "We plunder mountains, cut down trees, exterminate animals. Communities proliferate where once there were forests and swamps. We continually settle people in new territories. We have subdued the world, put iron and animals to our use, subjugated the colored races, coarsened relations among nations, and placated the masses. A righteous order is still a long way off, while injury and misery grow." And as I read that, I thought, he's speaking about colonization, the colonization of the lands, the colonization of the peoples. So when we think about the impact of colonization, we have to understand that there's reconciliation and there's restoration and reparations, and we have to figure out how we're going to walk in the world in a better way and bring a cultural humility forward. So a way of being is to think about cultural safety. And this was a graphic, happy to share it with you if anybody's interested. This was a graphic that was created, a number of us called in a circle on cultural safety. We worked for a couple of years together to try and figure out how do we own our responsibility, particularly as settlers, to create a culturally safer environment. So we're doing that internally, but we're also trying to stimulate that beyond. And one of the things to understand is when people are colonized, and children have been colonized as well, get back to the institutions that we used to put kids in. That's a colonizing response to children who are vulnerable. When people have been colonized, they lose their voice, or their voice is stolen from them. So that's one of the most important things to think about, is where is voice, where is the hearing, where is the ethic that we bring into our work. And basically, what we heard over and over again, the long piece of work that we did, was being culturally safe feels like being respected, understood, honored, cared for, valued for who you are, included, and in a safe place to share. And when people feel unsafe, what you see is the data is unequivocal. You see health outcomes worsen, you see life outcomes worsen, school participation goes down, attachment is damaged, people get physically sick, emotionally sick. So when people don't feel safe and don't feel like those things, respected, understood, honored, etc., then there are significant physical, emotional, and social damage caused. So it's really important that we figure out how to walk the talk. Any questions so far?
Jennifer?
Yeah.
Is it okay if I share
Absolutely.
your PowerPoint with the group? So you need to sign, each of you who hasn't, on Canvas, except Canvas, and I'll place it there so you'll have access.
Great. So let me just take a pause because we're kind of coming into another part. Let me get a better sense of where are you from? So I get it. You're involved in the social pediatric movement, and then I know a couple of you. Where else? So let's just kind of go around. Where are you? Let's start with you, Judith.
My name is Judith, and my background is completely different. I'm from education or PG, computer science and business. And my interest is mostly in Holocaust and the anti-Semitism and children in development.
Oh, okay. Thank you. Alicia.
Hi, Alicia, and I'm a doctoral student here at EBC in the School of Nursing.
Oh, okay.
And I'm working with Richard and Ray Cam, and we'll be researching the Circle of the Child.
Nice. Okay, that's great. And so with your background in the healthcare system, you'll really understand this deeply as well. Okay, let's go to you.
I'm a secondary school teacher in Richmond, and I'm also a master's student here.
Awesome. Okay. And so that's good. That'll be interesting to have some chat with you on the role of the schools in all of this Sabrina?
I'm with Society for Children and Youth of BC.
Oh, nice. Okay,
Yes.
we have a good partnership. Yes, exactly.
Yeah.
Yeah. Great. Of course, I'm assuming you know everybody. Okay, great. So it's just for my benefit now. Jane.
I have spent most of my life working in theater, often working with children and creating projects with children. I'm actually here because my grandparents were colleagues of Chuck. I know, and I wanted to learn more about his writings and what we are studying, which is the impact in the world.
Yeah. Wow. That's pretty cool.
Yeah.
Yeah. So you introduce yourself. Do you pronounce it Clea?
It's Clea. I'm a family nurse practitioner in the Richer Initiative Social Pediatrics Program.
Okay. Cool.
So my name is Alice. I'm a daycare teacher. Work with children aged 3 to 5 in Richmond, and also I'm also a master student in BC.
Fantastic. Oh, great. Good range of ages there.
And I'm Anida. I'm a high school teacher and the guidance counselor in a Francophone school board in Vancouver.
Okay, good. Thank you. And
I am Anton Grunfeld. I'm an emergency physician. I'm a member of the Korchak Association of Canada.
lovely. Nice to meet you. Great. Well, thank you for that, giving me a bit of a sense of who's in the circle here. So, being able to walk the talk in any of the areas that we're involved in, I think this is an important calling for us to think about cultural safety. And when you think about it, the notion of cultural safety, we've focused very much on indigeneity, but cultural safety is an experience that people could have, and you've got in Richmond, you've got a very significant population of Asian, South Asian, and so you have to think about, so what's it like? Where do they see themselves? How is it that their traditions and practices and whatnot are being honored? How is the school constructed to ensure that they have voice and also understand the context within which they come from? So the notion of cultural safety is not just about indigeneity. Okay. So the other thing about this is it's not a checklist. It's not just like, oh, well, yeah, we've done this and therefore we are a culturally safe organization. I do see that. And the important thing is, and this also relates to the experience of the child, is we can never say that we have created a culturally safe space or that we have created a space in which young people are ethically engaged. It's always their right to tell us whether they feel that or not. It's their experience, not us thinking, oh, well, we've done this and this, therefore we are this. So, and for us, we work with this model of cultural safety. So cultural awareness is the head. Let's understand the story in the background. And I'm even thinking, within the Francophone community too, there's, the interests of young people and their families when they feel perhaps less included in society or less valued for their Francophone roots. And how is it that we, as practitioners that might not be connected to that community, how do we need to educate ourselves? What's the head work that we need to do to understand the child's experience? Understanding, which is the heart stuff, beginning to really build the empathy. Humility, which is recognizing that we have a responsibility and that we have some complicity in maintaining certain systems the way that they are. And then over that, as we move through that, we can become more agile and responsive. So, I'm just going to skip over that. Yes, here we go. How do we affect change? So I think for any of us that are involved either in individual or systemic advocacy, we need to think about where are the different ways in which we might be able to affect change. So one thing is to think about where are kids attached or connected, or who's responsible for delivering services. So beginning to think, well, it's not just about the obvious ones, the Ministry of Children and Family Development or the Ministry of Education. It's also about thinking about the impact of poverty, so poverty reduction. It's also about thinking about the impact of healthcare and access to healthcare, right to a physician, for example. But it's also thinking about how do we hold up our families and the caregivers, and how do we support the children and youth so that they clearly have a voice as well. And what are those other community organizations, some of which you were involved in here, as community partners? Okay, so there are a few areas that we have to think about. So if we're going to affect change, what are some of the, there we go, what are some of the places that we might affect change? The other thing is, what are some of the systems within which we might affect change? We can work individually with a child, and that's a very important and legitimate way of bringing about change, of being able to advocate or support that young person as they get what they need. But we can also think about the broader service delivery system. And what are some of the things that we need to be impactful around in terms of our broader systems of care? So for example, if we're seeing that children and youth in the education system, if we were seeing that graduation rates is going down for a certain population of young people, would that not say to us, we have to take a look at what's happening and see if there's public policy or funding or clinical practices or whatever that needs to change in order to support those children going forward? So what are the service delivery systems? So when I think of in the early years, for example, that you're involved in, Alice, the kinds of things that are systemic changes there, it's changing dramatically. On the one hand, you've got we're on the verge of universal childcare, so that will change the dynamics for families that have been struggling to provide good care, good quality care. And then that is a public policy decision that can change a lot for a child and family. So when we start to see the evidence in support of certain public policies, then that's an area that we can affect change. Funding, public policy, clinical practice, etc. But the other thing that often we forget about, because we speak to one another, sometimes we are not mindful of the importance of also thinking about how we bring about change in public sentiment. How many of you take a look online news? Yeah? And do you go to the comments section? It's interesting and appalling at the same time. So if there's an article on, I don't know, UN or missing and murdered Indigenous women and girls, that was heartbreaking. So this report comes out, it's heartbreaking, and then you go down in the comment section and you see all sorts of really, really derogatory, negative, harmful attitudes being expressed in these kinds of things. That says to me that we have some important work to do in the broader public discourse as well. And really understanding that our work, and it gets to the safe and sound, if we aren't also thinking about the way in which we change public minds or attitudes or inform or help people understand, not just to judge, but to say, well, where might that be coming from? Like, what's given rise to that? And what is it that we might need to offer? I think about the way in which certain populations are stigmatized, the way in which certain children are judged, like these young women is being judged as non-compliant or unresponsive to the offers of care. It's like, okay, well that comes from our service delivery system, but it's reinforced often within our broader public narrative as well. So it's important to think, like, where can we affect change? And what is the most important area that we might want to work on in a particular situation? Okay, let's try this. There. Okay, so for us, many are the ways that we could do that, and you've all got different ways in which you can affect change. So beginning to identify and discern what are those different ways that you can use your voice, or you can support young people in their voice in order to affect change. And I think I'll just end on this one, and then we'll open up for some discussion and some stories. But where do we need to focus our attention is always an important question. In any one of your areas of practice, I'm sure you could say, there's this, and there's like 15 things that you would like to see changed. So one of our responsibilities as advocates is to say, so where do we think we can affect some change within the spheres of influence that we individually have or collectively have? So where do we need to focus our attention and how do we discern that? From my view, I think what's really important is that we listen to people who really understand. So this is Cindy Blackstock. How many of you know Cindy Blackstock? Okay, if you don't know her, please look her up. So Cindy Blackstock is the Executive Director of the Caring for First Nations Children's Society of Canada. And she has been a tireless, she's a good scan woman from British Columbia. She worked in British Columbia. She's now in Ottawa. And she has been a tireless advocate. In fact, she's the recipient of one of the Korchak Awards, right? From several years back. Yes, yes. This is an extraordinary advocate that we need to learn from. And if you go on their website, you can actually sign up to, I can't remember what the campaign's called, but she's very, very knowledgeable about social movements and campaigns and engaging people. She's also been a tireless advocate in the public policy domain in that she raised the disparity of funding for Indigenous children between if you were living off reserve and you were living on reserve. And so she won. It was a horrific story, but after many years won in the Canadian Human Rights Tribunal the case so that the federal government was required to ensure that there was appropriate equitable funding on and off reserve. Still trying to get that implemented. She keeps going back to force the government to try and get it implemented. But here's someone that not only is a tireless advocate, but she's a brilliant person at raising, and really listening into children's voices. So how do we discern? We listen to people that are really amazing advocates and who are very connected to the experience of children. And on her website, by the way, there's some really great stuff on youth engagement and children's voice. And she'll bring lots of stories about what she's heard from young people. The other thing about how do we discern is we listen into communities. So this is a community up in the Fraser Canyon area that I had the opportunity to meet with. And they were really attuned, and what was beautiful is they came from education, from health, from mental health, from Indigenous governance, from a wide array, early years, and they had a really good sense of what was happening in their communities. So we listen to community. That's a really important place to discern. And then we ask. So these are some examples I ask whenever I go out into community, and I've done hundreds of those kinds of sessions. I ask two things. One is, what do you think our office needs to pay attention to? What do you see in the work that you do that's important to pay attention to? Tell us about that, because those are the early warning signs or significant signs. And I ask, what are you proud of, or what's made a difference? So I ask this of everybody. And youth are amazing at what they share with me. So these are some sticky notes, some from youth, some from adults, but they share with me the things that they think we should pay attention to and the things that they have made a difference in their lives if they're young people, or that they're proud of if they're service providers. And when you start to ask people, it's amazing the intelligence that you get. Then you can start to theme it and work with it and say, oh, okay, well, this is the time. Okay. So I'm just going to leave that there. So first of all, any questions about what we do or why we do it? Okay. So the intention, I think, in sharing this was to give you an example of an organization that's taken a rights-based approach to try and advocate for child and youth well-being. A couple of things I want to say. One is that we are learning how to be most effective. So we've been in existence 12, almost 13 years. Yeah, almost 13 years. And we've had lots of, kind of iterations, and I'm the third representative. We've tried lots of different things. Some things have worked, some things haven't worked. So in the process of trying to be the best advocate you possibly can be, there is no perfect solution. And keep trying, keep learning, etc. So that's one thing. The other thing is that having a value core seems to make a huge difference as well. If you know why it is you're doing what you're doing and what it is you're being called to, that's why the photograph of Bradley and little Granny is so important. Like, what are we trying to bring to life? And when I read, and I just recently read Betty Lifton's book, which I hadn't read before, so thank you for sharing that.
The Kino Children, yeah.
Yes, and just the story and Korczak's own process of trying some things. I mean, the story of the first couple of nights in the camp, the first time, and how, you know, things went sideways, and how he brought that curiosity. It's like, okay, well, that didn't work, so then now what might work? I think that that's a really important consideration as well, of how is it that we might continue to learn about how to bring about the best environment, and how to have a strong value core, so that when things are going sideways, you have a place to, okay, well, what do I really know? I know that it's really important to bring, you know, all the things that were in that poster. Love, respect, inclusion, participation, the right to be heard, those kinds of things. How is it that what I am doing is or is not fulfilling that kind of core of purpose and responsibility? And then the other thing I think that you might want to take away is that with when we create institutions or organizations such as ours to try and uphold a child's children's rights, then you can't do it alone. So all of those, you know, all of those gatherings, the sticky notes, all those kinds of things, creating those allies and those relationships becomes so important as well. We couldn't do our investigations, even though we have significant power, you know, if we didn't have relationships with people or build relationships in the course of trying to gather information. We certainly can't do our advocacy work without building those relationships and trying to find a way forward and putting the child at the center, even if we have disagreements about the services that we may provide. So those are a couple of things about the organization that might be takeaways for you, and hopefully that's helpful to kind of say, well, how does an organization adopt or implement children's rights? Now, we do refer to the UN Convention all the time. So when we do our reports, I've got some examples here. We refer to the significant articles. When we are speaking to groups and trying to bring about shifts in public awareness and whatnot, we talk about the UN Convention, the UN Declaration, etc. So it's really important to speak about child rights as well, in order to raise awareness. And this is a public awareness piece too, is that oftentimes people have quite a simplistic view of what child rights are, and don't really understand some of the origins. So when you talk about those clusters, that actually helps people understand the 3 Ps, I think. It's like, oh, well, yeah, it is important to provide. It is important to protect, and it is important. And then we can start to see that as a platform for participation, because a lot of folks really struggle and say, well, you know, just because a child wants to have a later curfew doesn't mean we should always listen to them. Like, we do know best. We hear that a lot. And it's like, well, let's unpack that a little bit. Like, how could that child be heard in the conversation about curfew or, you know, their ability to go and be with their friends or whatever? Let's unpack that. Let's figure out how that child might be able to have some agency and decisions in their lives. So those are a couple of things to think of. And when I think of the Society for Children and Youth that we're partnering with, we're taking a look at representation. So there are a lot of things that happen to kids over which they have no control. And what ends up happening is when significant decisions are being made, their voices become diminished. So one of the things we're doing with your organization is to try and take a look, how do we create more space for child's voice and child's right to be heard? So sometimes you have to be very, very practical and pragmatic going forward as well.